We are able to really change lives. We've helped since the time we opened. We've had about 450 people come through the clinic, and 90% of the patients have responded to the treatment, which is amazing.
Hey everybody, welcome back to the show. Hope you're just as excited as I am for this episode. For the first time, actually meeting in person. We've had many of conversations over the phone, on Zoom. You know how it is in this digital age. Everybody's Zooming all the time. But I'm really excited to talk about this, and I'm really curious about this topic today. So without further ado, I want to introduce, this is Lori Clens from New Life Ketamine Clinic. Great to talk to you. And again, great to officially meet you in person.
Thank you.
Yeah, and so we've had a lot of different discussions, more marketing talk here and there about just different ways of promoting some of the other businesses that you work with. Mm-hmm. But today we're switching gears and we're talking about your business today, and this is New Life Ketamine Clinic.
Yes.
And how long has it been around now?
We opened in 3.5 years. We opened in October of 2020.
Okay. And so I definitely want to talk a lot about what ketamine is and its primary use for what you're using it for, and the New Life Ketamine Clinic, what it's all about. But let's just touch real briefly how this whole journey for you started. I don't think anybody necessarily wakes up and says, I'm going to start a ketamine clinic. So what did that look like for you, getting this business off the ground and helping people in the way that you do?
Well, so my husband actually, he was managing some clinics, and one of his patients at a clinic had a noticeable difference in his demeanor and how he was. Like before, the patient couldn't actually make eye contact with anyone, didn't talk to anybody, but would go in for his appointment with the doctor and then come out and never have any correspondence with anybody. And my husband just, greeted him and he said, "Hey, how's it going, man?" And my husband was shocked and he said, "Wow, things are going well for you." And he said, "Yeah." He said, "I just went and had IV ketamine and it was tremendous. I had treatment-resistant depression and I feel like a whole new person." And so my husband came home and we started researching it, and we both had some medical sales background. And so both in the psychiatry arena. And so we were curious. And so we just started doing research, and we saw all these stories and just kept doing more research on it. And we realized, people are flying to New York, Boston, Chicago, trying to get this treatment. And we're like, well, let's figure out how we can bring it to people here in Dayton. And so we found an anesthesiologist that agreed to be our medical director and the person giving the infusions when we initially started. And he was all in favor of it. He's an ex-veteran. And so, of course, that's something near and dear to his heart as far as helping people with mental illness, because we know how many veterans have PTSD and some of the things that go along, with what they see on a daily basis. So it took us a while to open the clinic. We finally opened in 2020. But unfortunately, right before we opened, my husband's cancer came back. Mm-hmm. So, he died about a year later. But I've kept on with the clinic. I've found wonderful people to help run the clinic, and we are able to really change lives. We've helped since the time we opened. We've had about 450 people come through the clinic, and 90% of the patients have responded to the treatment, which is amazing. If you think about people with depression and anxiety, 30% of the people in the country that have depression and anxiety are treatment resistant. So they're on a bunch of different medicines that have tried all different things, and they still don't feel good. And then they come and they get a series of IV ketamine and they feel better.
And so, this is something that's still relatively new for me. I heard about New Life Ketamine Clinic. Actually, it was a news story that the station that I work for had ran, and I've just been hearing it more and more frequently in terms of what this is. If you were to just kind of sum it up for somebody, which I think you've done just already an incredible job just summing that up in your story, and I appreciate you sharing your story as well. But ketamine, it has, at least how do I want to put this? For somebody that isn't familiar with its benefits, they automatically say, like, well, ketamine, isn't that drug of sorts. Can you explain that just so for myself, for people listening or watching, so they can get a clear understanding of what ketamine really is?
Right. Okay, so ketamine, people hear it as a horse tranquilizer or a party drug, club drug. So ketamine has a lot of different uses. Ketamine was originally developed for use in animals. So say in Jurassic Park where they would blow the dart to try to put them down if it were real.
Which favorite movie of all time, by the way.
Good. I'm glad
So
to hear it.
now we're already on the same page. You start dropping Jurassic Park references.
Yeah, dinosaurs. So anyway, but they blow a dart at him to put him out. Well, it's probably ketamine. I mean, we know it's fake, but this is what they use for large animals all the time when they need to sedate them. They would blow a dart and give a bolus. That would be a very large dose, right, to put something out. But ketamine has been used in humans since 1964. So it's been used extensively for almost 60 years now. It's a very safe drug. It's an anesthesia medicine, but it also has analgesic properties. So it's good to put people under for surgeries. That was the original use in humans, was anesthesiologists used it, say, in a surgical situation rather than using gas. They'll use the gas, but ketamine is actually an IV. So it's, like I said, it's very safe because of its properties, the fact that it doesn't cause respiratory suppression. It's one of the only anesthesia medicines that doesn't cause respiratory suppression, which is how we are able to use it in low doses in an outpatient setting, right? So, but ketamine does have the stigma of being a club drug. It was used inappropriately, but so is cough syrup. So is, a lot of things are used inappropriately. But when used in a controlled setting, it's a very safe drug to use. So, but they found in about 2000, first of all, let me back up. In the late 80s and 90s, they realized that there's this whole glutamate system in our brain that they didn't really know much about before, right? And I'm not exactly sure how and when, but at some point they realized that ketamine actually works within the glutamate system of the brain. 80% of our brain is glutamate responsive. They kind of call ketamine like a dirty drug in a good way, in the sense that it does a lot of different things. It works on a lot of different receptors. And so it has a lot of uses. It's used for pain, it's used for mental health, it's used for anesthesia. It stops like CRPS at the little bit higher doses than what we use for mental health. It really helps people with, severe pain, fibromyalgia. It's wonderful to help patients with fibromyalgia. And then, of course, a lot of patients that have both the chronic pain and fibromyalgia also have mental health issues, right? Who knows what came first, the mental health issues or the pain, and then, they lead to each other, right? There's a lot of cross comorbidities there, shall we say.
So when somebody discovers you for the first time, or any ketamine clinic for that matter, wherever it's offered, what does that process typically look like? And you mentioned it's typically used for those who are treatment resistant. Mm-hmm. And they've tried everything and anything under the sun, and they go to you, and it's like a last-ditch effort. Tell me about what some of the people are dealing with when they walk through the door and what you guys are looking for.
Right. So we are very careful about making sure that patients are treatment resistant, right? We're not first line. I've had a lot of people hear about ketamine and they call and they're like, hey, I want to try this, and, to explore my mind. Well, we don't do that, right? We are strictly going by, treatment resistant patients. We like referrals from psychiatrists and therapists.
And just to be clear, so when we say the symptoms that they're dealing with, depression, anxiety, what, anything else? So yes, these are patients that are depression, anxiety, PTSD, post-traumatic stress disorder, suicidal ideation, often referred to as SI, and it doesn't mean that they're actively suicidal. We're very cautious. If someone's actively suicidal, we send them to the hospital. But a lot of people have this ruminating thoughts that they'd be better off not alive. The world would be better without them. There's no need for them here on earth. And people have these thoughts every single day of their lives. Most often they don't do anything about it because they know they have loved ones that it would affect. But to even have those thoughts is a very sad existence, right? Ketamine does amazing
it's amazing for suicidal ideation.
And so how does that process work then? They come to you, you screen them, you want to make sure that the person in front of you is someone who needs the treatment, and they need it. So what does it look like? Someone walks through the door. Is it a series of doses, or is it all done in one sitting? How does that work?
Right. So we will do, we go over their records. We have a consultation with them. And then if they want to go on, they will have the infusion. So we do a series of 6 infusions over the course of 2 to 3 weeks. Some people like to finish in 2 weeks, some people, 3 weeks because of their schedule, right? So it is hard because you really can't drive and you can't work right after, usually, most people. So certainly if you have a job where you have any life and death decisions or have to stand or anything, you could not work afterwards. But you feel okay about 3 or 4 hours afterwards. You're just tired prior to that. So we do a series of 6 infusions. Most of our patients feel fine at the 6 infusions. Like I said, we've treated over 400 patients, closer to 450, and 90% of the people respond. We've had a few people, I would say fewer than 10 people have needed more than 6 infusions in the initial series. So, we kind of follow the ASKP3 guidelines, which is the governing body, of the ketamine providers, right? So we are keeping patients very safe, and we follow, what's established protocols, so.
And I believe we actually have a few testimonials for some people that actually came through New Life Ketamine Clinic. Let's take a quick look at those.
Okay, so there's multiple clinics, ketamine treatment clinics, and the thing is that what you're looking for, people that go through depression, post-traumatic stress disorder, the stuff that I went through, is really people that really truly care and want to help. And that is why I personally drive an hour from Cincinnati to Dayton to come here. And I'm not being paid to say this, okay? I drive here because this is more like a family type of atmosphere, because it is family owned and operated. But you just get that treatment. And people with depression, post-traumatic stress disorder, stuff that I have, that's really important. And that's why I drive all the way here. I wouldn't go anywhere else.
I would say I'd tried probably like 30 different medications for anxiety and depression over about a 10-year course. There was a surgery that I had had for a splenectomy, and my surgeon was telling me about ketamine and how amazing it was, but it wasn't really available to people yet, but hopefully in the future. So when I started to look for other treatments after everything else had failed and the ketamine ad popped up, I already knew that that was something that I should look into, because my surgeon had already told me a year before how amazing ketamine was and that it was going to change the world. So when I saw the ad, I knew I had to look into it. And as soon as I heard from you, I knew it was the right thing. Ketamine has definitely opened up my mind in so many ways. It's done more for me than what I ever imagined it would. I thought that I would just be free of depression, anxiety, maybe even just temporarily, but it's done so much more than that for me. It's honestly changed my entire life, my whole perspective on myself. And then I was able to love myself for the first time ever. And through that, I was able to love other people better too. It's the best thing I've ever done for myself. And I fully encourage anyone to do this for themselves too.
Okay, so we just heard some testimonials just there. What does it mean for you, and what's it like for you to hear the results of people who maybe have tried so many different other options before? They came to you dealing with whatever was going on in their life, and you were able to offer them a solution to that difficulty they've been facing for quite a while.
Yeah, it's very rewarding. So all of my providers that give the infusions in the clinic are, they work in the trauma units at the hospitals and ER. And so, that's a tough role, right? So then they come and they work for us in the clinic, and just the feeling that you have after you hear, I feel like I got my life back. And we hear it every single day in the clinic. Like, I can give you an example. I'm not in the clinic every day, but I popped in on Friday and was there, and I had 2 patients, just life-changing results. Like, one was a 28-year-old girl who was in a wheelchair from her pain. She was actually referred from a local pain doctor, and but she also had mental health issues, so she chose to go through the mental health protocol. And after 6 infusions, after her second infusion, she was out of the wheelchair. She's now walking on a walker. And then after her 6th infusion, she is ready to even give up the walker. The poor girl couldn't walk 2 weeks ago. She was a 28-year-old girl, or 3 weeks ago, 28-year-old girl. And she was smiling, and she said she's felt better than she's felt since she can remember, really. So.
And is it something that has to be an ongoing thing that you continue to do for whether it's the rest of your life, or is it just something as needed? What does that look like?
So in the 3.5 years we've been open, 70% of our patients have not needed any boosters. We call them boosters. So you do the series of 6, and then after that, you determine whether you need to have one or not. We send monthly, assessments, like mental health assessments, and we encourage everybody to fill those out. We also make wellness checks on people, just make sure they're doing okay. Everyone's following up with their psychiatrist and therapist. That's part of it. We want people to understand that the IV ketamine is a part of the journey, but it's not going to fix everything if you're not putting the work in, right? You still have to do some work to, feel your very best, right? Make lifestyle changes, healthy eating, healthy habits, exercise, and then we definitely want you to work with your therapist and your psychiatrist. So,
and just out of curiosity, because there may be somebody who watches this or and has different opinions. They watch or listen to this episode and they have some different opinions on, well, is that the best option? What do you say to the people who may not think that this is the way to go? And in your opinion, since you've obviously, there's a lot of passion behind it, and I can hear it in your voice because of the people that you've helped so far. But everybody has a different method of getting from point A to point B. What do you say to those people who say, that's not for me?
I understand that people have reservations because it's something different, but I think I want people to understand the safety of, ketamine's profile. It's a very safe drug. We don't add anything in that would cause them, any kind of harm in the clinic. Now, there are some places that are adding things in, like propofol, which does cause respiratory suppression and shouldn't be as an outpatient setting. Very dangerous. So I encourage people to, if you're considering it, do your research on the clinic. See how long people have, 1, been in business, and 2, been practitioners, and 3, what are they putting in there? Because, ketamine is the new rage, right? So people, I don't mean new rage, but I'm saying, like, there are a lot of people trying to open up ketamine clinics just
that are doing it all willy-nilly, not necessarily knowing what they're getting themselves into, kind of opening Pandora's box and not realizing the safety measures that need to be taken in order to make sure that people are getting the results and being safe in the process.
Exactly. And so we are very cautious in our practice. We keep patients very safe. We don't run like 3 and 4 infusions at a time. Everything is about keeping the patient safe and getting them the best results. So I can tell you this, that, like I said, 90% of the patients that have come through have had success with it. Most would consider it to be life-changing. We've had people that, have been on, most of our patients have been on anywhere from, 4 to 25 different medicines. Nothing worked. Nothing made them feel good. Or they had so many side effects from the medicines. Most of the antidepressants have terrible side effects. Weight gain, sexual dysfunction, nausea, constipation. And it can affect people's relationships, let's face it. So anyway, ketamine is a very clean drug. It's in and out. We do an IV, it's out of your system within 5 hours, but it still continues to work in your brain. So how ketamine works is different than the oral antidepressants. So ketamine, instead of laying a blanket over the receptors, like, say an SSRI lays a blanket over serotonin receptors, ketamine actually forms new neuroplasticity in your brain. So it works in the glutamate system and the NMDA receptors, but it also also works in serotonin and GABA and norepinephrine. They call it a dirty drug in a good way because it goes a lot of places, right? So it's forming this new neuroplasticity, and so it helps you break old thought patterns. It helps you form new thought patterns. So what happens is people that say they got stuck, they couldn't get beyond where they were in therapy, all of a sudden therapy becomes more productive now, right? Because they have these new thought patterns. They can work through and figure out how to minimize and avoid triggers and how to deal with them if they do have triggers, right? But that's why ketamine's a portion of what, their journey, but it's not all of it, right? They need to work with a therapist.
And I think that's a huge piece that probably needs to be emphasized there. And I'm glad that you mentioned that this is not an end-all, be-all. And I think that's coming from you and hearing you say that too, that just, I think, even more illustrates the fact that you have the best intentions of making sure that people are handling this in the best way possible. And you said that there are other people that are opening these ketamine clinics that don't necessarily have the best intentions.
Yeah, and it's unfortunate. I think my biggest fear is that someone's going to get hurt because of lack of maybe overconfidence in their skills and their abilities. I have a very experienced team that works for us, and so we don't take risks with patients at all. I also have the medical director that is my medical director now because my anesthesiologist was too busy at the hospital. So now my medical director is a critical care specialist at Miami Valley Hospital. So, I have like the highest level of people taking care of our patients. So, and I do want to go back to your point. You had mentioned, how does this work after, they do the initial series? Do they have to keep doing it forever? Mm-hmm. We don't really know. Ketamine, has only been used since 2000 was the original clinical trial for IV ketamine. But it's been used a lot more frequently since 2015. It's just becoming more mainstream. But what I can tell you in our experience is that 70% of our patients haven't needed any boosters. Of the 30% who do need boosters, the average is 1 to 2 a year. Now, we do have a handful of patients, definitely maybe like 7 patients that come maybe once a month or every other month for a booster, but that's really rare when you think of the number of patients that we treat. And they would so much rather come in and get a booster than add 3 and 4 psych meds that give them all kinds of side effects.
And so, I've heard this illustrated to me before and described, and again, I am not a medical professional, but I know that growing up, my mom was very anti-medication for the kid, no antidepressants, no, you don't need to be on prescription drugs.
Right.
That's the way that I was raised. You just don't do that. And so I guess you talk about like when everything else has failed, this is kind of like that last resort, but it's part of a bigger picture. This is part of the journey. And what would you say to anybody who is a little apprehensive about this as well? Because I'll just put it from my perspective, right? Grew up, no prescription drugs. That's not the way to go. What about this option? What would you say to somebody who has that mentality going into it?
Right. Like I said, we do treat treatment resistant, so it would be difficult. We would need someone to have a psychiatrist. Obviously we like psych referrals anyway, but we need to make sure that they at least have a clear medical diagnosis and that they've talked to their psychiatrist and their psychiatrist says, okay, if you're not going to take oral medicine, then you can try ketamine, right? And honestly, ketamine, I'm hoping it moves up in the, choices. You're considered treatment resistant if you've tried 2 antidepressants and have not had success or couldn't tolerate them. So in reality, these people that have tried 5 to 25, as ketamine has more experience and we have a lot more patients that have been on it and we can continue to show the safety profile of ketamine, I would love to see ketamine moved up to, this your 3rd or 4th thing that we try instead of, a combination of 5 different medicines. I mean, we've had patients come to us on 5 or 6 different psych meds, between the mood stabilizers, antidepressants, the benzodiazepines, which are so addicting. They're more addicting than heroin. And yet they prescribe them.
Well, I think what I was trying to say earlier, and I kind of lost my train of thought, was, I've heard it described to me as those are like Band-Aids.
Yes.
Antidepressants, prescription drugs, they're Band-Aids to a deeper problem. Mm-hmm. And you mentioned something earlier in terms of how your brain is malleable, how it's almost like clean slate.
Yep.
That's the way, when you were describing it, that's the picture I had in my head. Whereas prescription drugs, it's literally numbing you to the feelings or the emotions that you're experiencing, whereas this ketamine gives you that blank slate. It's like a file wipe.
It is. It absolutely is. It's rewiring your brain, if you think about it, because it's forming the new neuroplasticity and new synaptic connections, right? And then you can just think differently. People come out of an infusion and say, I am now unstuck. I feel free. I feel peaceful. Just the things that people say after their infusions. And many of them say they feel like they have 10 pounds lifted off their shoulders.
Interesting.
Yeah.
And so, the one thing that I know we already mentioned this is, there will be some people that just have more questions, because as you mentioned, more people are diving into this world, but there's still a lot of questions that need to be answered, and they want to learn as much as they possibly can. What would you say would be the best way to get in touch with you to where you can have that conversation to know that this is the right option for them?
Yeah.
And I know that, you have people that drive hours to your office, and you've told me that. And there might be somebody who might be a few hours away from where you're located. But why would you say, hey, let's at least have this conversation to see if this is something that might be a good fit for you?
Right. Well, they can come to our website, newlifeketamine.com, and call. Myself or Emily, the other clinical care coordinator, mostly Emily answers the phones. But I'm willing to talk to anybody who wants to talk. Both Emily and I have been through the treatment. Obviously, I had some pretty major things after I lost my husband. Mm-hmm. And I had pretty crippling anxiety. And so I did the series of treatments, and it helped me. I couldn't get through my days. I had a hard time focusing, and I had a lot on my plate. And so, the grieving process is not easy. And so anyway, it's helped me tremendously be able to focus and deal with what my life looks like now. And I'm at peace too with where my husband is now, right? Because he's at peace. Mm-hmm. So anyway, just have him call. But I don't. Did I answer your question?
Yeah, no. It will, basically, bottom line, we'll make sure that we have everything that you need to know, whether you're watching this episode, you're listening to this episode, down in the show notes below, underneath the video, wherever you are consuming this content, a way for you to get in touch with Lori and her team at New Life Ketamine Clinic. But again, it starts with a conversation, knowing if it's a good fit for you. And that's something, again, based off our conversation here today, and even when we spoke before this, that your number one priority is safety.
Right.
And I think that's
safe.
I think that's the one thing that has been the recurring theme since we've had these conversations of, before you came on the show, that there's a lot of people that aren't doing this safely. And if I don't speak up now, I'm not only putting this ketamine into a bad light, but I'm putting people's lives at risk by not speaking up.
Yeah, and that's why people will drive 2 and 3 hours to come to us, because they see what we can do, and they talk to me. And so the other thing I do, is it okay if I talk about the different forms of ketamine?
Yeah, absolutely.
Because I don't know how long we have, but
well, tell us a little bit about the different forms.
So there are some different forms of ketamine, and so I feel like it needs to be addressed because there's IV ketamine, which is actually the gold standard. Most of the clinical trials were done on IV ketamine, right? It's 100% bioavailability. We put an IV in your arm, you get all the medicine, and it can be dosed precisely to the patient, right? So there's a 0.5 milligrams per kilogram is how they initially dose it. And then we can go up. But then there's also S-ketamine or Spravato, which is a big pharma. What happened is ketamine's an old drug, right? So it's off patent. So big pharma said, well, how can we make money off of a drug that's off patent? So they made a derivative of ketamine called S-ketamine, and it's a nasal spray. So they have it's dosed differently, going through the nose, but it's only about 60 to 70% bioavailability, has so many more treatments and so many more side effects. I'm going to put in quotations covered by insurance, but because of the so many more treatments and the price that they charge for it, the copays, by the time you do a series of Spravato treatments, one, it's not as effective, and two, you're a lot of times paying more than what it costs to pay out of pocket for the IV ketamine, right? So, and not to mention that so many of those patients end up coming to get IV ketamine because it didn't work as well. So then they've just increased their costs, right? So the other thing that I really want to caution people about is the tablets. So there are these companies, and I don't even know how it's legal. The DEA is looking at shutting it down, but there are these companies that do online, they mail you tablets of ketamine. Okay, ketamine is an anesthesia medicine.
That doesn't sound too safe.
No, it's not. It's an anesthesia medicine. We don't know how they're going to take it, and I feel terrible saying this, but think about what happened with Matthew Perry. Mm-hmm. It was the oral ketamine that he took, not the IV that he had 10 days prior. It was the oral ketamine that he took. We don't know how someone's going to take it. He drowned, but it was from the effects of taking an anesthetic dose. He took, 3 or 4 times what we give in the office, and he fell asleep in a hot tub and passed away. So we don't know if your 19-year-old kid's going to get those pills, right, and take those and do something with them. Ketamine still has a stigma of a club drug, so if someone finds out about it, that you have ketamine in your home, it's just not safe. Mm-hmm. So, and at the low doses that they use for the oral, it's really not that effective. It takes a long time. The best way to get the treatment is IV ketamine.
Okay, and that's where the big underlying concept here is do your research, make sure you know where you're going, have a conversation with the professional, which you said that you have a staff that medical professionals that are not only passionate about what they're doing, but they do it to such a high level of precision and expertise that everybody that walks through the door, that they're in good hands. And as someone who has experienced it for themselves, and
yes.
I'm pretty confident that, based on what you've said, you're confident that they can serve people to the highest level.
Absolutely. Yeah.
There you go. So once again, real quickly before we wrap things up, your website, the best place for people to give you a call, and where you're located at.
Sure. We're in Centerville, and the phone number is 937-689-5994, and our website is newlifeketamine.com.
Okay, and we'll put all that down below, once again, in the show notes, underneath the video, wherever you're consuming this content. Lori, thank you so much for coming on.
Thank you for having me.
Yeah, absolutely, and sharing what you're passionate about. At the same time, it's coming from a great place of wanting to help as many people as humanly possible. So thank you so much for your time.
Thank you.
And we'll see you next week right here on The Zach Pitt Show. Hey, thank you so much for watching. I hope you enjoyed this week's episode, and I really hope that you enjoyed the music that was underneath some of the segments in the show. And to be completely honest with you, as I was building things out, I didn't want to go through the whole mess of trying to find a bunch of royalty-free music so I could use it in the show. So I went ahead and I just used the instrumental tracks for my debut album, Midwest Romance, and I want to give you a signed copy of my album for absolutely free. All you have to do is help me cover the shipping and handling. Now, I totally get it. You can listen to the album on Spotify or Apple Music, any other streaming platform. But again, if you get the signed copy of the album, it's also going to come with some free goodies as well that you cannot get anywhere else. Again, a signed copy of my debut album, Midwest Romance. If you just help me cover the shipping, I will go ahead and send it right to you. Once again, thank you so much for watching this week's episode. Hope to see you next week right here on The Zach Pitt Show.